In the UK, around 3 million people have osteoporosis, and the numbers are rising rapidly. It's known as the silent disease because it often goes undiagnosed until someone has a fracture. Women who've been through the menopause are most at risk, but men, younger women, and children can also be affected by this painful condition. Early diagnosis and care ensures the best long-term results.
I was diagnosed about 3 years ago, and when I had the initial diagnosis, frankly, I was deeply shocked. It must have taken about 6 months before I could come to terms with it. My thinking was, gosh, this has got a huge impact on my life. Also, the prognosis was pretty dire. The damage to my spine had been happening well before I even turned 50. So to find out at my age that not only do I have very severe osteoporosis, but I already have some fracturing in my spine, it's quite a difficult thing to get your head around.
Consultant rheumatologist Dr. Millicent Stone leads the osteoporosis team at Circle Bath.
Osteoporosis is more commonly known as brittle bone disease. So in your bones we normally have spaces and we have connections between the spaces. What happens in osteoporosis is those spaces become bigger, more porous, and the bone takes on the appearance like a honeycomb. And the bone as a result then becomes weaker, more fragile, and what eventually can happen is the bone can fracture or break. Okay. Common risk factors are loss of estrogen around the time of the menopause, excess smoking, excess alcohol, a previous history of a fracture, or history of osteoporosis in the family.
Osteoporosis can affect people in many ways, but there is a lot that Circle's health professionals can do to help. The hospital follows a system of integrated care, where a multidisciplinary team look at all your needs together.
What we have here at Circle Bath is a unique setup where we do have a one-stop shop. All the disciplines that are involved in the care of an osteoporosis patient are under the one roof.
Hello Adrian, how are you?
I'm fine, how are you?
Nice to meet you.
Nice to meet you too.
Everybody from consultant rheumatologist, orthopaedic surgeon, physiotherapist, bone density radiographer, nurse practitioner and dietitian. This is more efficient for the patient, it gives the patient a better experience, and it's actually more enjoyable as a clinician to treat your patient knowing that you have the necessary expertise and resources around you to give that patient the best possible experience.
Lindsay has to have regular bone scans to see how the disease is progressing.
The DEXA scanner measures bone density, and it is the best way to check people's bone strength. And this scanner is very quick. Each view is done in about a minute, and if you've got patients who have possible spinal fractures, then lying on their back is not the best thing for them. So the scan can be done very quickly and causes very little pain and discomfort.
And just try and centre yourself in the middle somewhere.
Osteoporosis is often regarded as a women-only disease, but that's not always the case. Adrian Ewer has been diagnosed with osteopenia. This is a condition where bone mineral density is lower than normal and is considered by many doctors to be a precursor to osteoporosis.
Well, at 43, I wasn't expecting to get osteopenia, and especially knowing what I know now, I'm glad, A, that I've caught it early, but B, I've been given some fabulous information as to how I can change my diet, how I can keep fit, how I can watch what I smoke and drink, change the way I start to keep this in some sort of check. So for me, I'm glad I've caught it early because I can now do something about it and reduce the risks and any onset of osteoporosis.
The orthopaedic specialists at this state-of-the-art hospital are an essential part of the team. Osteoporosis sufferers are at high risk of fractures, so Circle's orthopaedic surgeons support the team's work to prevent the need for surgery.
In orthopaedic surgery, we interact with the osteoporosis team, unfortunately, often at the end stage when things have gone wrong. And one of the main complications of osteoporosis is fractures, and that's where we come in. Prevention really is the key here. The load on the NHS, both financially and the human cost, is huge related to fractures. due to osteoporosis, and there's estimated to be about 300,000 a year in the UK, so it's a big problem.
I don't like hospitals. I don't think many people like hospitals, but coming here is a very relaxed atmosphere. You've got everybody here that you need. You're not sat waiting around for long periods of time. There are no signs here at the hospital, and there's none of the smells that you normally get that induce that claustrophobic sense. So I'm very pleased when I come here. It's not a task.
It's so important to get the right healthcare and to have a caring team of people that work with you, and people who are thinking about not only of your needs now, but what your life in the future may be. And I really, really can't stress the quality of communication between you and that team, and their willingness to work with you is so important, so important.